We're going to start with an apple tree, which represents the very beginnings of transplant surgery. Skin grafting goes back literally thousands of years, and it's one of the world's oldest operations, mentioned in the Sushruta Samhita, which is an ancient Indian surgical text. But its modern history starts in 16th century Italy, where a few secretive families of surgeons used it to repair damaged noses. Now, in 1549, a renegade surgeon called Leonardo Fioravanti stole this secret from a Calabrian family, and what he found related to apple trees in two ways. First, the technique was very similar to that farmers used to graft trees. Basically, you cut off a young and healthy branch from one tree and strip some of the bark off a branch of a second. This creates two open wounds that you then bind together, and these supposedly unite within 21 days. If you apply that to human skin, you have a skin graft. And surgeons used this farming technique to transplant skin from someone's forehead or forearm to another part of their face. In fact, the human graft was so close to the agricultural graft that when Fioravanti wrote about it, he referred to transplant surgery as the agriculture of the body and the farming of men. In fact, skin grafting was a peasant's operation. It wasn't even taken seriously by the medical establishment until the end of the century, when Gaspare Tagliacozzi, who was a student of one of Fioravanti's friends, wrote a book about it. Our second object, which is a quill, will take us to the first blood transfusions in the middle of the 17th century.